The fear that comes along with joint replacement is probably up there with just about anything in medicine. A lot of it related to the pain that people anticipate having. So the Patient and Family-Centered Care program was a program we started at University of Florida in 2015. Ultimately, our goal was to improve value of care for the patient, the family, and also for the hospital and the health system. The main things that we found that seem to improve care from the patient side are, number one, really remaining focused on them and their experience from the outset. So improving communication, improving education, making sure that they understand ahead of time what we expect of them, what they should expect during the surgery, what they should expect after the surgery. Other things we focused on that seemed to be very effective were improving their access to us both before and after the surgery. So we hired more nurses, and we hired a nurse administrator, a nurse navigator, who would be somebody that the patients knew they could always reach out to and contact, both leading up to their surgery and afterwards. We run a joint replacement education class, and the patients are required to go through this class before they have their joint replacement. And that's an opportunity for them and their loved one to come and meet the nurses that will be involved in their care after surgery, the physical therapists that will be involved in their care. Additionally, we found that patients were spending somewhere between 3 and 4 days in the hospital when we first started this after the surgery. We've now been able to bring that down to under 2 days, so the majority of our patients spend just 1 night in the hospital. And we found that that was beneficial in terms of preventing complications, also lessened their risk of infection, but also it got them back to doing things more quickly that they wanted to be doing. The patients overwhelmingly tell us that they really appreciate the different experience that they're having. They love the feeling that the whole joint replacement experience is really focused on them. And they have really noticed a difference between other care experiences they've had in this.